So as a nurse, you're in charge of making sure the patient is okay. One of the first things we do is assess your orientation. What is your name?
Edward Gonzalez.
What is the year?
2013.
Great. Where are you?
I'm in Ronald Reagan Medical Center.
Great. And why are you here?
I am here learning about the profession of nursing.
Right. So it's really important that a patient knows all those 4 questions. If they don't, they're off for CT scan because something is going on brain-wise in their head, whether it's water on the brain or whether it's a bleed. Really important that they know those 4 questions. We ask it to them every 2 hours.
Okay.
Another thing nurses do is we do vital signs all the time. It can be every 5 minutes, every half hour, every hour, every 4 hours, depending on, in the ICU, we do every 15 minutes. So underneath the tongue, we use paper thermometers. Another thing that is important is that we do blood pressures. We do them every 15 minutes in the ICU. And with technology, everything is all just by typing things in and boom, it works. So watch. I'm going to type it in for every 15 minutes. And it automatically starts taking. With my alarm limits, I set my alarm limits, and if something's out of whack, it's going to alarm me right away. So even if I'm not watching my monitor is already going to alarm me for what I need to know. And oxygen, it's really important. Basic airway, keeping you guys safe. So we need to know your oxygen saturation. So how are you breathing on room air? Right away by plugging you in right here. I'm going to be noticing your oxygenation up here. Within 10 seconds, I'll know how your breathing is. Also, what is important is knowing what your heart rate is. It's very important that your heart rate stays between a certain level. Right there, your oxygenation is 97%. And then your temperature, we do it in Celsius, is 36, so no fever. I'm going to hook you up. And this is what I learned in nursing school, is the white is right, brown is in the middle, grass is below the clouds, smoke is above the fire. That is your basic EKG, and right there, that's going to be your heart rate. You're running pretty slow because you're young and athletic. Right there, it's going to probably be in the 60s. And this is your respirations. It's going to be taking it in just a minute. This is heart rate. You always want to have 2 different leads because if your heart stops, you got to confirm it in 2 different leads that you actually don't have a heartbeat. So I have lead 2 and lead V1. There's your heart rate. Remember I said 60? You're 59. It's a slow. You can just, as a nurse, you can just learn by things. You can just tell that it was slow. Okay? Your blood pressure. Look, so it didn't work. As a nurse, you got to troubleshoot. This did not work because this wasn't plugged in. So now we'll retake it. So you never kind of get worried and jumbled. It's like, okay, what's not hooked up? So if that oxygenation went to 88, I'm not going to get all weirded out because look, you're breathing, you're looking normal. Maybe it needs a new oxygen probe. Maybe this wasn't connected here. Maybe it wasn't connected here. You troubleshoot before you get all nervous. Okay, you've got to work with your technology. Okay. So right now, I have a basic heart rate here. With this machine, you can do a 12 lead, which will show you every single aspect of your heart. So, and it's everything's totally labeled on here. V6, that'll go, actually I'm going to put that down here. V2, V4, V5, I actually need one more lead, and V3. I need to get, and here it is, one more electrode. So see, blood pressure is 123/79. And then right here are my alarm limits. First thing I do when I come in is I set my alarm limit. So if I need to be worried, let's say your blood pressure needs to be over 130 because we're perfusing your head because we're watching for vasospasm. I would put my alarm limits on. Let's watch. Let's say I needed to keep you bumped up. I would put my alarm limits on. And if you didn't make that, it would alarm me right away.
Okay.
And then I'd be like, hey, something's not right.
All right.
Okay, but we know that you're fine. And then I'm going to do a 12 lead on you right now. Everything is through the computer. Go under EKG. I'm going to do my 12 lead. 12 lead now. You wait literally 20 seconds. Boom, you got a full readout that the cardiologist can read. Just like that.